All right, I have begun the recording. Now I would like to ask for a quick introduction to yourself and your line of work.
Sure. My name is Michelle Fox, and I'm a genetic counselor. For many years, I was a genetic counselor at UCLA, and I'm currently a consultant to Invitae, a genetic information company in the San Francisco area. And I work remotely from Los Angeles.
Great. So, what would you say are the goals of this career?
Genetic counselors are healthcare professionals who help people understand genetic medicine and genomics. So, if you have a problem in your family, like cancer runs in your family, you might want to know if there's a cancer gene in your family, what that means for you and your family members, and what are your options for genetic testing, and what would you like to do about that?
Okay, so it's it's a healthcare profession that works specifically with genetics to identify like health problems and how to work through them, perhaps like inherited health problems.
Exactly. So many people have issues in their family or medical issues themselves, or have a child with a medical issue. They want to know, is it a genetic condition? What should they do about it? What are the testing options? What will the test options mean for them? What will it mean for family members? What's the prognosis? And anything to do with a genetic problem that you might identify in your family or yourself. That's the main job of a genetic counselor.
Got it. That makes a lot of sense. Thank you. What would you say is the work life or experience of a genetic counselor?
Well, it depends on where you work. I can tell you about my experience. As a clinical genetic counselor at UCLA, I saw patients almost every day, and I worked mostly in pediatric and adult genetics. We saw a lot of parents who came in who had children either with developmental delay or autism or a birth defect, and they wanted to know, why did this happen? What is the a testing option? What's the treatment for the child? What's the prognosis? Explain the inheritance pattern if there is one. If you are a genetic counselor that works in a genetic testing company, like I do presently as a consultant, then you're mostly talking to other healthcare providers. You're talking to doctors and nurses about what test to order for their patients. So it really does depend on where you work as a genetic counselor. And currently, there are many options. Genetic counselors work in many, many different aspects of the healthcare industry.
You said earlier that you were working remotely. How does that look?
I was very lucky because when I wasn't lucky for COVID, nobody's lucky for COVID, but I was lucky that I was already working remotely for Invitae. Because that set me up to work remotely. It's not my favorite way to work because I don't know if you can tell, but I'm a very face-to-face person, and I would much rather be talking to you face-to-face, Jessica.
I'd
But
love to talk to you face to face as well.
but and I think genetic counselors are really a lot of they're people persons. You know, they like to talk face to face. But I have to say that having worked remotely for these last almost 6 years, it's really been an easy transition to keep working remotely during this time. But many genetic counselors who were working face to face, like the team at UCLA, have now had to do telehealth medicine. And genetic counseling actually is really set up to do telehealth medicine because what we do is talk to patients. It may not be optimal, but it is a very easier transition than for some other aspects of healthcare.
Thanks. So, what drew you into genetic counseling and how did you get into this career?
Well, I think you can tell I love talking to people and I love science. And that combination is what drew me in. And I think you'll hear that from a lot of genetic counselors. I had graduated from undergrad with a bio degree and knew I wanted to do something in science. I started teaching middle school science. I was a dismal failure. I was too young and I wasn't a good teacher at that point in my life. I had no experience. And then I became a lab tech. And most lab techs are those people that have one foot out the door. What are they going to do next? So I applied to dental school of all things. I don't even know why. I got waiting listed for dental school when I heard about genetic counseling. And I was living in New York at the time. And genetic counseling just combined everything I love to do. Talking to people about science is just everything. And that's really what drew me to the profession. And I was very lucky to make the right choice.
Cool. So, what would you mentioned earlier that being a people person and being interested in the sciences attracted you to this career and often are traits that you can see in a lot of genetic counselors. Would you say that there are, what would other traits that would make people a good fit for the career be?
Well, I think you have to be very curious because genetics is changing all the time and the technology is changing all the time. So you really have to be a lifelong learner to really want to capture everything that's happening in this profession and to keep up with the profession because genomic medicine has expanded and I kind of grew up as genetic medicine grew up. So I was really lucky in that regard. I think you also have to be sort of comfortable with uncertainty because even when you take a genetic test, there's a lot of gray areas sometimes, and there's unknowns right now. We don't know everything there is to know about genetics. So I think you have to be comfortable with that also.
I see, I see. How has this career changed you as a person, or has it not changed you as a person?
Well, I think I've had to become a lot more flexible. I think I was a very inflexible person. I think I like to have everything in order and like to have a control of everything. And then you learn that people are very different, and each person I saw was different from the last person I saw. And there were a lot of challenges with that. So I think I become more flexible. And I think I have to stay humble because there's no way that I can know everything there is to know about genomics medicine. Sometimes I joke with people that I know less now than I knew when I started as a genetic counselor many years ago.
All right. So, do you think it expanded on some feelings you may have had about, like, regards to science or regards to, like, different aspects of life now that you've had your time as a genetic counselor?
Oh, absolutely. My very first love of science was the periodic table because I love the order of it. Well, it turns out that that's just the tip of the iceberg in science. Okay, so I just think I just love be expanding my mind. I have to tell you, quite honestly, that there's never been a day gone by that I've been a genetic counselor that I haven't learned something new. And that's pretty amazing because I am older and senior in this profession, and I've been doing it for a long time. So that's saying a lot.
Wow, every day, huh? That's
Every day.
I agree that is pretty amazing. So, sorry for the downer question, but are there any downsides to this career or any regrets that you have may have had that due to choosing to be a genetic counselor?
I have to say, I really honestly can say there are no downsides. Now, when I have had to give bad news to patients, it is heartbreaking. And I have to tell you that it really is heartbreaking. And I think that some people probably this would not be the career for them if they were in a situation, especially in a certain area where they were giving bad news and it was either too close to home to them or they just weren't comfortable with it. So I've had to get comfortable with that. You never get comfortable with it. That was the wrong word. But I have to accept that some of my patients are going to get bad news. On the other hand, we give a lot of good news too. And that's just those are the best days of my life.
So it's just a possibly a norm of the medical career where sometimes health
Mhm.
may not be positive. I see, I see. Okay.
And I have to say though that there's always hope. That no matter what the situation is and however the news is, how bad it is, there's always hope for our patients. And that's one thing that's really important for genetic counselors to get across to patients. by giving them resources and the help that they need to support them.
That's wonderful. How would someone get started in genetic counseling? Like, for example, either how would you get a job or what degrees are needed, that kind of thing.
Right. Well, genetic counselors are trained in master's programs, and most individuals who go into the master's programs are either bio majors or psych majors, or combination of those, because you're really learning the science and you're learning the psychosocial skills to explain to patients about all of these things that we've been talking about. So you graduate with your master's degree, and it's a career training program, master's. You sit for a certification exam, and there's licensing in some states. But how would somebody first get started to find out about it? Like the students in your high school, by going to NSGC, which is the National Society of Genetic Counselors, it's nsgc.org, is absolutely the best website that people get educated about the career. And it's important to get educated early to see what the prerequisites are, what it is, what it does to take to be a genetic counselor, and then to reach out to a genetic counselor. We're very accessible. There's a find a genetic counselor on the nsgc.org, so people could really reach out and find somebody just to talk to about what this profession is like, just like we're talking today.
Great. So you mentioned, I don't remember the exact wording, but is it, correct me if I'm wrong, but are there things such as like internships or like on the job training available for genetic counseling?
Yes, there are. So what happens in the genetic counseling programs, for example, I'll start with that first. When you're in the master's program, the first year is pretty didactic. You're taking a lot of courses. And then the second year, you have internships with genetic counselors. And that's how you learn to be a genetic counselor. So first you're observing, and then your supervisor is observing you do genetic counseling. So those are the internships in the master's level. As undergrads, there are internships. They're not really internships, but there are ways to find out about genetic counseling, working in genetics units. There also are undergrad special interest groups in many universities now throughout the country that really help people prepare for the profession. But what high school students can do to prepare themselves is really to get some experience talking with people, either through peer support, crisis hotlines, volunteering for advocacy groups. All of those things help prepare people who really want to talk to people how to communicate, because that's what master's level programs in genetic counseling do, how to communicate with people about a very difficult topic on any level that needs to be communicated.
I see. So is there anything else that you think is important for someone to know who's interested in pursuing this career?
Well, I think that it's really important to really love science and like to talk to people. Now, there are a lot of genetic counselors that work in a lot of different areas. Some work in public health, some work in teaching, some work in management, and now as never before, there's many, many opportunities. So it really is a field that's very wide open now, and it's expanding. And I think it's really a hot field, if you know what I mean. I think that we're there now. When I started, there were 2 genetic counseling master's programs in the country, in the entire country, and now there's over 50. So that shows you the expansion of the profession, and there are more jobs for genetic counselors all the time.
Any last words or input that you'd like to say to the students looking to get into genetic counseling?
Well, I would like to say, if you like people and you love science and you're a lifelong learner, this is the profession for you. And I welcome you to talk to me, to talk to other genetic counselors, to go on the website and really educate yourself about the profession, because I think it's one of the most exciting professions around.
Well said. Thank you very much. I'd just like to thank you, both you and Howard, for your time, because I really do realize that it was uh, inconvenient to have to push back the meeting by a little bit just because of my Wi-Fi. Very sorry for that. I'd really like to thank you for this opportunity to interview you. And with that, I will be stopping the recording of the meeting.